Hello, fellow forum members everywhere. I hope you are safe and well. I'm John Flood, Professor of Law and Society at Griffith University in Australia. I'm going to talk about the human rights and privacy issues that arise from governments and companies wishing to track the progress of COVID-19 among its citizens and users. Ever since the Spanish flu pandemic of 1918, it has become increasingly essential to understand how diseases spread both within and between countries. Spanish flu killed millions of people, many of whom were already weakened by the First World War. Since then, we've had SARS, Ebola, and MERS. But our modeling techniques have improved immensely, especially with increases in computing power and the advent of machine learning and artificial intelligence. The single most necessary element for modeling and tracking is data, lots and lots of data. And data enables computers to predict future behavior with refined precision. Our questions then are, who does the data come from? Who supplies data? How do they supply data? We also ask, under what conditions do we give the data? Do we consent? If so, is it with informed consent? Is the data taken from us without consent? Are we even aware that we have given away our data? Shoshana Zuboff tells us companies like Google and Facebook amass so much data about people, they can predict what we will do, what we will buy, and even how we will vote. So we should anticipate that data gatherers will vacuum up everything they can, regardless of its immediate relevance, because the algorithm might come up with ways of incorporating previously unused data. Then we must ask, how is this data going to be used? Does it contain identifiable elements so that we can pinpoint individuals? Or will it be anonymized so that its main uses are in the aggregate? In terms of use, who will use it? Will it be shared? In the case of coronavirus, is it just the health ministries that will use it? Or will it be used by immigration agencies, labor departments, or law enforcement? And most importantly, how long will these data be kept for? Will they be destroyed after the pandemic is over? Or will they persist and perhaps be added to? Presently, over 20 countries are using digital tracking. 7 countries are using physical surveillance, and 11 countries have imposed COVID-19 related censorship. The potential for human rights abuse is momentous, as are disinformation campaigns that could easily harm people. A few countries have even shut down their internet access. Thankfully, a number of countries and the United Nations fervently believe, however, that internet access is one of our basic human rights, not merely a luxury. While we can acknowledge the necessity of digital tracking in order to safeguard our communities at this moment, we mustn't lose sight of the necessary limits we need to place on government and corporate power. We cannot just abandon our morality, our ethics, our systems of regulation permanently. But who is to protect us and how? Let us take 3 examples of surveillance happening now. In each we can see preventative and compassionate motives. But we must be mindful of what will happen to these data after the pandemic. First, Singapore, mindful of its earlier experience with SARS in 2003, has pursued defensive initiatives aggressively. Testing rates are high. Those who test positive are isolated in hospital, Those who've been in contact with a coronavirus victim or who are asymptomatic are traced through an app, Traced Together, that uses smartphones. And they are home quarantined. The app claims not to collect geolocation data, but it has been very helpful in giving government information about who connects with whom. These people are sent a number of SMS messages a day to see if they're adhering to quarantine rules. If they leave their phones at home, teams come into their homes and check on them and can fine big fines. They can levy big fines. Tracking is credited with slowing the progress of the virus. Besides tracing people, the Ministry of Health made information about victims of coronavirus known to the public, which has raised fears of discrimination and stigmatization. The status and future longevity of these data are unknown. Now, secondly, a significant number of Taiwanese work on mainland China. So, with the first news of coronavirus, Taiwanese inspectors boarded planes to check passengers coming from China. Travelers who've been to high-risk areas were quarantined and their movements were monitored through their smartphones. Those who have been to low-risk areas were given SMS passes to clear immigration. The government, also experienced after SARS, gave doctors and pharmacists information about patients' travel histories and medical files by combining data from its National Health Administration and the Immigration Agency. It created a database of potential coronavirus patients, and those victims could also add to it their changes in their conditions and so forth through the use of QR codes. Through this tracking and data collection, Taiwan has effectively prevented the spread of coronavirus. And it has made efforts to ensure no stigma attached to being infected, but nothing has yet been said about the future of those data. In the United States, mobile location data from millions of phones is being used to track how people move during the coronavirus pandemic. 2 tech companies used heat maps to show how people on a single beach in Florida fanned out across the US and spread the virus. But no consent was given for the use of this data. Also, a number of tech companies, in conjunction with Harvard and Boston hospitals, are using crowdsourced data to track coronavirus hotspots and help prevent future pandemics. The privacy statement is unclear as to what happens or could happen to the data collected. This kind of tracking is primarily for mapping rather than individual tracking purposes, but the data could be used in any number of ways. In each of these cases, we have no answers to the questions I posed above. These could be short-term methods, or they could be incorporated into normal government or corporate monitoring techniques. What we are facing here are data collection and data use processes that we may have little control over, or no control. Most people have no idea what data they are giving away, or to whom, nor do they realize what can be done with this data, how it can be used to control their lives. Everything will be known about us. Our behaviors will be shaped without us knowing. What are the solutions? First, we mustn't let measures introduced in pandemic times become normalized. We need to be able to determine why tracking may be necessary. If its primary purpose is to attenuate the growth of the virus and protect people, it may be justified for a defined period. What protections do our current regulations like the GDPR give us? If they aren't sufficient, let's discuss, consult, and draft new ones. But they must be based on consent, not imposed. Or if consent is difficult to achieve, then we need close monitoring in order to ensure the lack of consent is not used to bring in other sneaky rules. With parliaments closing down because of the pandemic, our ability to hold government to account and question it is becoming so much more difficult. Second, government must not think it can replace big tech or adopt the same data gathering techniques as them. In addition, big tech must face up to its responsibilities in disseminating fake news and disinformation. At the moment, Facebook, for example, only partially takes down misinformation posts because of public pressure caused by scandals such as Cambridge Analytica. Political misinformation posts, however, are not taken down, despite pressure. If it is unable to proactively deal with this, we must bring in accountable regulation. People and users should have a body to appeal to for help in these situations. Big tech just can't hide behind its guise of a free provider. We know it makes enormous profits from people's data. Third, we must educate people about technology. It's one thing to understand how to operate a smartphone, but it's another to comprehend what is happening to one's data. As I said, most people don't know that their data is being collected, or by whom, or where it's being sold, or what is being done with it. Present terms and conditions are opaque and written in legal speak, which no one, including lawyers, really understands. Present institutions meant to protect us have opaque processes unintelligible for ordinary people, and this includes the courts. Nor are they suited to the globalized world in which we live, as we are being bound by mostly national boundaries. In this respect, we must applaud Tim Berners-Lee's initiatives to return the internet to people through, firstly, his contract for the web, in which he articulates 9 core principles that apply to government, companies, and citizens. And secondly, through the creation of the solid ecosystem, which returns data to the creator and lets people decide for themselves how it will be used. There will be much opposition to these initiatives because the financial stakes are just so high, which makes supporting them all the more important now. We also need to formulate appropriate normative frameworks that don't cede too much power to government. I recommend James Nicholls' work here on normative frameworks for human rights in emergencies. A laudable read. We are, in my view, at a critical point in our history where we must be vigilant and hold every institution accountable for its actions. Thank you.